very, very excited and honored to introduce our didactic speaker for today. He's none other than Professor Emmanuel Otolorin. And he'll be talking on the topic, which is of really great interest to a lot of us, respectful maternity care. What matters, especially to her being the woman. Professor Emmanuel Otolorin is currently the Senior Regional Programmatic and Technical Advisor to the JPIGO-led Tip-Top project. Prior to his present position, he was JPIGO's country director in Nigeria and chief of party for 3 consecutive USAID-funded maternal and newborn health projects in Nigeria, during which he had oversight of respectful maternity care programs in Nigeria, and is therefore really suited to be giving this didactic today. Before joining JPIGO in 2000, he was a professor of obstetrics and gynecology at the College of Medicine, University of Ibadan, and honorary consultant obstetrician gynecologist to the University College Hospital, Ibadan, Nigeria.
Thank you very much. Good morning, good afternoon, wherever you are. First, I'd like to thank the organizers of this ECHO series of lectures for inviting me to be one of the lecturers. And they've asked me to talk about respectful maternity care, what matters especially to her, that is the pregnant woman. I hope you can see my slides. Can someone please confirm?
We can.
Yes, we can very clearly.
Thank you very much.
Yes, sir.
Good. So during this lecture, I will be talking about disrespect and abuse in pregnancy and childbirth. I will look at the definition of respectful maternity care. We will examine the content of respectful maternity care, and then we will look at some recommendations for respectful maternity care in Nigeria and other low and middle income countries like Nigeria. But I'd like us to start with a poll. And if I would like you to log into the address below. It's a Poll Everywhere address. If you have Microsoft Edge or Google Chrome, that should be the preferred application to use for entering this website.
So, Prof, we put the link in the chat. So everyone,
Yes.
if you can just go to the last chat and click on the link, it will take you to the poll. You won't leave the meeting, but it will take you to the poll, and you'll be able to see Prof's questions.
Okay. So when you log in, this is what you will see, a screen that gives you the opportunity to put a name or skip or just continue to answer the questions. Let me give you a minute for people to do this.
Please feel free to unmute and let us know if you've done this.
Okay, if you can't unmute, but you selected the link, just to be sure we're together on the same page, you can just type yes in the chat so that we know that you were logged in and you're not having any technical difficulties. And if you do, please, you can also type in the chat, and we're very excited to help you through this. Yay, nice, nice. Okay. Yes, so just simply select the link and every other thing is going to just be directed straight at you, and you would know what to do exactly.
Okay, Prof, back to you.
All right, thank you. So I'll go on to the very first question, which is a true or false question. Disrespect and abuse in childbirth is an acceptable Nigerian culture. True or false? Please just answer your question, the answers. Okay, thank you. I'm going to lock it now. The correct response is that it is false. So 80% of you got the answer. It is not acceptable Nigerian culture. As you will see later on, nearly 100% of women like to be respected. So we'll go to the next question. This is a multiple choice question. The answer really is dependent on you. As a healthcare worker, have you ever witnessed disrespect and abuse during childbirth? I just want to know. Okay, I'm going to lock it now. This is interesting. I think majority of you have either frequently or rarely witnessed disrespect and abuse during childbirth. And that tells me that you probably know a lot about what we are going to be talking about. So let's move on to the next question. The next question is a true or false question. Physical abuse is the most frequent cause of disrespect during childbirth in Nigeria. True or false? Physical abuse is the most frequent cause of disrespect during childbirth in Nigeria. True or false? Okay, I'm going to lock it now. It looks like opinion is equally divided.
Yes.
47% think this is true, 53% that think this is not so true. Physical abuse is a problem, but it is not the most frequent cause of disrespect during childbirth. As you will see later on, there are other forms of disrespect which are much more common than physical abuse. Thank you. Now, the next question is an interesting one. It's really wanting you to find 2 or 3 words that you can use to describe disrespect and abuse in pregnancy. Just type in 2, 3, 4 words in the box, and all the words will be aggregated and we'll have a nice wardrobe map, very soon. So type in 1 word, 2 words. There you go. Somebody has typed in rude, neglect. Interesting. It looks like verbal abuse and neglect are quite common. Excellent. So if we look at this word, the bigger the words, the more common these words are typed in. So looking at nearly 60 people typing in, you can see that verbal abuse and neglect are the most common. I'm going to lock it now so that we can move on. Thank you. The next one is similar, but this time I would like you to type in words, examples of respectful maternity care this time. Respectful maternity care. I see privacy is coming up, care, nice, quality. Empathy. I like that. A lot of words to describe what we expect to be respectful maternity care. Empathy, privacy are the most important. Okay, thank you very much. This has been very interesting. I thank you for your contribution. Now we are going to move on to the, yes, please.
I was wondering, just before you start the content, if you could launch the pre-quiz now that is up and running.
Okay.
Just 3 minutes. Thank you so much. So everyone, you should have the pre-quiz up now. If you're on your phone or on your laptop, it should have popped up on your screen. It's 3 questions. Please go ahead and answer. We just have 2-3 minutes before we delve into the didactic session.
Yes. There are 6 questions, really easy questions. Just to test the knowledge base in the room. Please, everyone is encouraged to answer.
You have to scroll down to see all of the 6 questions.
Yes, you have to scroll down. Thank you, Prof. One minute. Please, everyone is encouraged to answer these questions, please. We've done 1 minute, a little bit more than 1 minute. We have 3 minutes for this pre-quiz. If you are just joining us, please feel free to, if you're not seeing it pop up, know that you probably joined after it was launched. But please, everyone that can see it can please answer the questions. Thank you. I can see some answers coming in. 17% of the people have answered. Thank you. I can see some responses. Okay, I can see a date Tutu. You can't see any questions. Okay, is either you probably joined after it was launched or someone will contact me. Our IT person would help you figure that out. Or you can just simply click on the polls and it should pop up. Thank you. 39% of people have answered. We have just less than 30 seconds to go. Please, everyone is encouraged to answer these questions. It is completely anonymous. We're not going to know who answered. We're not going to know your name. Thank you very much. 42% have answered. Please keep the answers coming in. Okay, should I give an extra 10 seconds so that more people answer? Please feel free to unmute and answer me.
Yes, please.
Okay. Thank you. I can see more people have answered. Thank you so much for taking part in this pre-quiz. This topic is a very wonderful and anticipated topic. I'm so excited. So 55% of people have participated. We have used almost 4 minutes. I think we should end the poll now so that we can continue with the due for today. Thank you, everyone.
Thank you. Thank you, Onyinye. Over to you, Prof.
Thank you very much. Now that you've had the opportunity to do the quiz, let's now go to the substance of the lecture. I'm going to talk next about disrespect and abuse in pregnancy and childbirth. Now, our local newspapers have had a lot to say about disrespect and abuse in pregnancy and childbirth in Nigeria. And these are just examples of newspaper cuttings that I have saved over the years to show the kind of negative publicity that healthcare workers have been attracting, in the news media. Take, for example, in Vanguard, how poor attitude of healthcare workers is killing healthcare delivery in Nigeria. Another one says bad manners of health workers is a major worry of patients. Another one says Nigeria's poor healthcare system is responsible for many deaths of women and children daily. And the one on the right at the bottom says hospital detains mother and the newborn baby for 4 months over a debt of 215,000 naira. And one that is in the middle says 90% of deaths in Nigerian hospital caused by healthcare worker attitudes. I don't think that is correct, but this is the kind of negative news information that we get on a regular basis. And in peer-reviewed journals, we've had a lot of publications from Nigeria, also looking at disrespect and respectful maternity care. We've had a systematic review on disrespect and abuse of women during childbirth in Nigeria. We've had one, respectful maternity care and midwives caring behaviors from Calabar. We've had an article from Ogbomoso looking at respectful maternity care or disrespect and abuse. We've had one from Abuja looking at mistreatment of women during childbirth, a qualitative study on perceptions. And one at the bottom of right saying by slapping their laps, the patient would know that you truly care for her. Is that really true? So a lot has been written in peer-reviewed journals on disrespect and abuse in pregnancy and childbirth in Nigeria. Let's look closely at a few of these articles. The article by Ishola and his co-authors in 2017 was a systematic review of disrespect and abuse of women during childbirth. And it looked at 14 studies. And the type of abuse most frequently reported was non-dignified care in the form of negative, poor, and unfriendly provider attitude. And the least frequent were physical abuse and detention in facilities. That's a question that should be familiar. We just looked at that in the quiz. These behaviors were influenced by low socioeconomic status, lack of education, poor empowerment of women, poor provider training and supervision, and weak health systems. And overall, we concluded that disrespectful and abusive behavior undermined the utilization of health facilities for delivery. Another conclusion is that by empowering women and educating them on their rights and strengthening health systems to respond to specific needs of women at childbirth, improving providers' training, and implementing and enforcing policies on respectful maternity care are important for mitigation of this problem. Now, Ijaduola and his team in 2019 published a paper lifting the veil on disrespect and abuse in facility-based birth care. These are findings from the Southwest. And they showed that nearly 100% of respondents agreed that it was their right to be treated with respect and dignity during childbirth. It's not a norm in Nigerian culture to accept disrespect and abuse. Pregnant women expect to be treated with respect and dignity during childbirth. Out of these, 19% had previously experienced some form of disrespect and abuse. That's about 20%, or 1 in 5. And the most commonly identified forms of disrespect were non-dignified care, mostly verbal abuse. This is quite common in pregnancy, quite common in the labor room. I'm sure many of you have either had it, or some of you may have even experienced it, most undignified care. Then discrimination, and then detention and abandonment. We just displayed a newspaper cutting of a woman and her baby who were detained for 4 months because they couldn't pay the user fees in the facility. Interestingly, over 80% of the respondents had no suggestions of how to improve disrespect and abuse during delivery services. In 2021, Oduenyi and her team published on gender discrimination as a barrier to high quality maternal and newborn healthcare in Nigeria. And they showed that harmful practices were observed in nearly 60% of deliveries, and disrespectful or abusive practices were observed in 34%. No providers offered clients the needed information or services or referrals for gender-based violence. 67% reported observing or hearing of an incident of violence against clients. And about 8% of providers themselves had experienced violence in the workplace. Now, 78% of providers did not receive any training on gender or gender-based violence in the previous 3 months of this survey. Going globally, the WHO in 2014 published information on facilitators and barriers of facility-based delivery in low and middle-income countries. This was a qualitative evidence. That study included 34 papers from 17 countries. And the findings were organized into 4 groups: perceptions of pregnancy and childbirth, influence of sociocultural context and care experiences, resource availability and access, and perceptions of quality of care. The key barriers to facility-based delivery were traditional and familial influences, long distance to the health facility, unaffordable cost of delivery, perceived low quality of care in the health facility, and fear of discrimination during facility-based delivery. Down in 2018, also published an interesting article, looking at what matters to women during childbirth. What do women want during childbirth? And from that publication, they concluded that what mattered most to women was a positive experience that fulfilled or exceeded their prior personal and sociocultural beliefs and expectations. This included giving birth to a healthy baby in a clinically and physiologically safe environment. Most women simply wanted a physiological labor and birth, not one with complicated by gadgets and so on. But women also acknowledge that birth can be sometimes unpredictable and quite frightening, and you have to be prepared to meet such unexpected events. So, with that background, we ask ourselves, what is respectful maternity care? In 2011, the White Ribbon Alliance defined respectful maternity care as encompassing respect for women's basic human rights, which includes respect for women's autonomy and agency, respect for dignity, feelings, choices, and preferences, including companionship during maternity care. And in 2018, the WHO defined respectful maternity care as referring to care organized for and provided to all women in a manner that maintains their dignity, their privacy, their confidentiality, that ensures freedom from harm and mistreatment, and enables informed choice and continuous support during labor and childbirth. The definitions are quite similar. They are all pointing to the same thing. Interestingly, companionship at childbirth seems to be one of the fundamental rights of women in childbirth. And one would imagine that many countries, particularly in Africa, do not have policies that support that idea. But that's not correct. In a study on policy of companionship, 53% of 42 countries that responded actually had policies that encourage or recommend the presence of a companion of choice during labor and childbirth. But in reality, if you go to many of our health facilities, the companion of choice is hardly ever present or given room. Neither is the facility organized in such a way as to make it possible for that companion of choice to be present for the pregnant woman. So there have been comparisons of these types of abuse and disrespect and the human rights approach. These are the 7 original types of abuse: physical abuse, non-consented care, non-confidential care, non-dignified care, discrimination, abandonment or denial of care, and detention in health facilities. And the corresponding human rights are freedom from harm and ill treatment, the right to information, to informed consent, and right to refuse treatment, respect for choices and preferences, confidentiality and privacy, a right to dignity and respect, equality, freedom from discrimination, equitable care, a right to timely health care, and liberty, autonomy, and self-determination. These rights were put together as the Respectful Maternity Care Charter on Universal Rights of Childbearing Women. And this poster was very popular and used all over the world, particularly in low and middle income countries, pasted everywhere in labor rooms to remind women of their rights and also to remind healthcare workers of the rights of women in pregnancy and childbirth. But since 2020, these rights have been expanded to 10 universal rights of women and newborns. And we'll go through them very, very quickly. First one says, every woman has the right to freedom from harm and ill treatment. The second one says, everyone has the right to information, to informed consent, and respect for their choices and preferences, including companion of choice during maternity care, and the right to refusal of any medical procedures. The 10th universal right says everyone has the right to privacy and confidentiality. Even simply putting curtains in between labor room beds provides visual privacy. But if you go to many of our labor rooms, you will find multiple beds without curtains in between, and companions who are present or staff who are walking in and out are seeing pregnant women at their worst periods during labor, which is very disrespectful. Then the fourth one talks about everyone being their own person, right from the moment of birth. And they have the right to be treated with dignity and respect. And that also goes for the newborn. A newborn that is born needs to be treated with respect. The way they are handled, the way they are treated, they should not be slapped or maltreated in any way. That right begins right from the time of birth. The fifth one says everyone has the right to equality, freedom from discrimination, and equitable care. No one should be discriminated against because of poverty, or because of gender, or because of ethnicity, or because of where they live, whether they're rural or urban. Everyone has the right to be treated equally. The sixth one says everyone has the right to health care and to the highest attainable level of care. You should not allow poverty, long distance, and so many other barriers to inhibit people from attaining high quality care. This is why you'll find in many civilized countries, there's health insurance where people pay a small premium and they have a right to best quality care when they need it the most. The seventh talks about everyone has a right to liberty, autonomy, and self-determination and freedom from arbitrary detention. We had talked about, given an example of how people are being detained because of poverty. They have been treated, they have accumulated unexpected hospital bills, they are unable to pay, their families are unable to pay, and the health facility decides that they will not be released until they pay. This is unacceptable, it's against fundamental rights, and they should come to a decision to allow for some instrumental payment and release the pregnant woman and her newborn. The eighth one says every child has the right to be with their parents or guardians. Labor rooms, post-delivery rooms must be arranged in such a way that the babies are kept with their mothers. Having an arrangement that allows you to separate the baby from their mother and put them in a separate area is unacceptable. The baby cot should be next to the mother, and so that the mother has eye contact with her baby right from birth throughout the time she's in health facility. And the ninth one says every child has a right to an identity. Once a child is born, that child is a person, is a citizen, and has a right to be given some kind of identity, to be registered and given that recognition. And lastly, everyone has the right to adequate nutrition and clean water. This is very important to ward off communicable diseases, which can be due to this, the lack of water, safe drinking water, or poor nutrition. So what has been done globally? The WHO, in releasing a framework, a quality of care framework, recognized that experience of care is very important and included 3 standards to monitor experience of care. And these 3 standards in the framework are effective communication, respect and dignity, and emotional support. And we will look more closely at those 3 standards. And these are the 3 standards. Standard number 4 that says communication with women and their families is effective and responds to their needs and preferences. And there are quality statements attached that can be used to monitor the compliance with this standard. Standard number 5 is more specific. It says women and newborns receive care with respect and preservation of their dignity. While standard number C says every woman and her family are provided with emotional support that is sensitive to their needs and strengthens the woman's capability. So what has JAPIGO done? Through the JAPIGO-led USAID-funded MT program and the MCSC programs, JAPIGO has promoted RMC as a central element of high-quality, safe, and person-centered maternal and newborn care in several countries. We developed operational guidance to support the design, the implementation, and monitoring of RMC. And specifically, we've supported RMC efforts in Nigeria, in Kogi and Ebonyi states between 2015 and 2018. This framework from the publication shows some design approaches for local content. The phase 1, in phase 1, you really are defining overall scope of activities within an MNH program content, identify and sensitize stakeholders, and conduct situation analysis. And in phase 2, you convene the stakeholders, review the findings of situation analysis, define the program goals, and develop a theory of change. and then move on to the design activities across system levels and design program monitoring framework. The more details can be found in the publication by MCSP on moving respectful maternity care into practice in comprehensive MCSP maternal and newborn programs, published in March 2020. So how can we measure respectful maternity care? If we go back to the WHO Quality of Care Framework and look at the standard 5, which deals with respect and dignity, there are a number of indicators that can be used to monitor compliance. 5.1, for example, looks at privacy around the time of labor and childbirth, and whether confidentiality is respected or not. 5.2 looks at absence of not subjected to mistreatment. And 5.3 looks at informed choices about the services. And we have tools that can be used. Either you use client exit interview tool or the client observation tool. And I've circled these tools depending on the particular standard that one is looking at. You can see that your choice of client exit interview tool or your choice of clinical observation tool will help you to assess compliance of the institution or the individuals with all these recommendations for respectful maternity care. And Appendix 6 of the MCSP situation analysis tools lists many of these other tools. You can see Tool 1 and Tool 2, provider survey and client exit surveys are quite relevant to the topic that we are discussing. There are many other tools that measure respectful maternity care. For example, the mistreatment index tool, MIST, the Mother's Autonomy in Decision-Making Scale, Mothers on Respect Index, provider attitudes to planned home care, labor observation tool, or community survey tool. Looking more closely at these tools, the MIST tool has just about 7 questions, looking at whether the person was treated, privacy, whether physical privacy was violated, whether the provider shouted or scolded her, and so on and so forth. The Mother's Autonomy Decision-Making Scale is also displayed here, and the reference is at the bottom of the slide. The community survey form and the labor observation form are also used to assess this respectful maternity care. So let's finally look at what are the recommendations for respectful maternity care. We should be promoting women and newborn rights in general and empowering women to give birth with dignity. We should be planning to display, implement, and enforce policies on the 10 universal rights of women and children. We should be facilitating provider behavior change by building the capacity of all clinical and non-clinical providers in health facilities. Even gate men, ward orderlies, need to know about respectful maternity care. We should develop job aids on respectful maternity care for all staff and other information, education, and communication materials such as wall posters, clients' information leaflets, and to communicate the importance of respectful maternity care within and outside the facility. We should regularly obtain feedback from our clients. If the banks can do this, if shopping outlets can do this, seeking client feedback, we should be doing the same in healthcare delivery. We should use client exit interviews to get that information. How satisfied are the pregnant women with our services? What can we do better? We should strengthen health system to respond to specific needs of women. For example, having a companion at childbirth, having curtains put to provide visual privacy, These are simple things, but very important for maintaining dignity of our women. We should recognize and reward institutions and individuals that promote respectful maternity care. This will encourage others to do likewise. We should support robust research to explore disrespect and abuse. What are the things that cause it? What are the best interventions that we can introduce to mitigate this problem? Finally, we should become more intentional in ensuring that all women and newborns are provided with compassionate, dignified, and respectful childbirth care as a fundamental human right. In conclusion, disrespect and abuse in pregnancy and childbirth are commonplace in low and middle income countries like Nigeria. There have been global efforts to mitigate this problem, culminating in the release of Respectful Maternity Care Charter, which spells out 10 fundamental rights of mothers and their newborns. Nigeria, through the MCSP program, has demonstrated successful pilot projects that can be replicated. Therefore, all healthcare workers attending to pregnant women during pregnancy and childbirth should familiarize themselves with the Respectful Maternity Care Charter and tools and institute measures to uphold the rights of pregnant women and their babies. I thank you all for your attention.
Thank you so much, Prof, for that informative and clearly understood lecture. Wow, this was amazing. I really hope that everybody else enjoyed this as much as I did. There was so much that was said.